Hi, my name is Campus Charles. I am pursuing a Master of Kinesiology at the University of Trinidad and Tobago. This video, entitled Therapeutic Exercise, is in part fulfillment of the course Exercise Prescription. Do enjoy. It is said that therapeutic exercise is bodily movement prescribed to correct an impairment, to improve muscular function, or to maintain the state of well-being. Miller and Keene 2003 also referred to it as the scientific use of bodily movement to restore normal function in diseased or injured tissues or to maintain a state of well-being. They also said that this type of program is designed to correct specific disabilities of the individual patient. The program is evaluated periodically and modified as indicated by the patient's progress and response to the prescribed regime. Now, the ultimate goal of therapeutic exercise is to return the injured participant to pain-free and fully functional activity. For this to be accomplished, we must look at one, reducing pain. We have to reduce the pain. We have to also restore the normal joint range of motion. We have to look at the kinematics, way that they move. We have to also look at flexibility so that we prevent further injury or the patient getting back to that state where they were injured. We also have to look at muscular strength. We have to look at endurance, coordination, power. It's also important that we focus on the cardiovascular endurance and strength on the unaffected limb. We must make sure that the person remains balanced and strengthened on both sides. Now, this program does not only focus on the physical needs of the individual, it also focuses on the emotional and psychological part of the individual. Because reaction to an injury may depend on the individual's ability to cope, and the individual's ability to cope with an injury may have a serious impact on the outcome of your rehabilitation program. Now, success or failure of your program hinges on some behavioral responses of the individual. So if the person has performance anxiety, that may impact on the program. If they have self-esteem issues, they lack that intrinsic motivational factor. If the person has a psychological investment in the sport, that may also impact on the success or failure of the program. Some support sources that were possibly available to the person may not be there now, and that may also impact on the program. The person may also have had a past stressor, right? Or they have a history of being stressed physically. Right? There may also be interventions that have been made previously that have failed. That may also impact on the behavior response of the individual and may also lead down to the program not being successful. The type of sport that the person played also has a part to play. The timing of the injury in the career of that person, right? The intensity of that particular player in the sport that they play, the intensity of the sport, the type of sport that they play will also have an impact on their mindset when they enter into this your therapeutic program. And that mindset may lead to success or it may lead to failure of the program itself. There are some persons who may have underlying health conditions, and for those persons, the program could be modified to suit their level of endurance, their ability, the severity of their conditions, or the stage of their particular recovery. Activities may be restricted to specific parts of the body, or they may be general activities aimed at returning the person to peak physical condition. Persons who may need this type of program are those who may be recovering from surgery and the tissues are inflamed and they need to heal, or they may have low bone density and the low impact and the weight bearing exercises may be beneficial for them because they are high risk of pathological fractures, or persons who may have painful or inflamed muscles and the resistance exercises may benefit them. There are also some contraindications that we should look at. Low intensity stretching and mild walking is usually recommended during a period of recovery. Caution should be taken while making twisting or explosive movements during the program. You don't want to re injure the person. You should also avoid overworking and excessive fatigue causing postures so as not to put too much a strain on the injured area. But wait, there are more contraindications, you know. There are two types of contraindications to exercise: absolute and relative. Absolute contraindications are non negotiable. The risk of injury or even death far outweighs the benefits of the exercise. So we don't want to play around with this at all. Relative contraindications, however, they are a little more flexible. Usually, some accommodations could be made to allow the person to exercise, but you pay attention and look out for any complications as they may come up. Take pregnancy, for example. Hemodynamic heart disease, a restrictive lung disease, uh, incompetent cervix, weakness in the cervix. The person had multiple gestation or they had risk for premature labor. They have second and third trimester bleeding or any ruptured membranes, or if they have any pregnancy induced hypertension. All these things are absolute contraindications. We don't want to play around with these. If we discover any of these, then any exercise during pregnancy must stop. However, if the person has these relative contraindications, like severe anemia or unelevated maternal cardiac dysrhythmia or chronic bronchitis, or they have a poorly controlled type 1 diabetes, or they suffer from obesity, or they are extremely underweight, or they have a history of extremely sedentary lifestyle, or poorly controlled hypertension or hyperthyroidism. Any of these contraindications, we can make allocations to still continue an exercise program, but we just monitor them closely. What about a cancer patient? There are some papers that suggested that cancer patients should not engage in any exercises during the treatment, but Borman in 2013 suggested that oncological patients should engage in physical activities during the entire period of their medical treatment and even the aftercare, taking into account the contraindications, of course. The therapeutic exercise should be customized according to the individual's cancer entity, their medical side effects, and the exercise experience. Basically, we are personalizing the exercise therapy for the individual. According to Bowman 2013, in Germany, cancer patients have a legal right to visit a rehabilitation clinic, and this is funded by the health insurance companies. Scara et al. 2017 cited this case where a 53-year-old man was injured while water skiing and suffered a proximal hamstring avulsion. He had surgery 8 days later. 7 weeks after surgery, he started a therapeutic exercise program. The program resulted in normalized physical function, and he returned to pre injury activity levels 6 months later. So it is never too late to start a therapeutic exercise program. In this type of program, we want to look at strength, endurance, cardiovascular fitness. We want to look at mobility and flexibility training, stability training, relaxation techniques, coordination techniques, balance, and some functional skills. Now, with the elderly, we must be extremely cautious. It is advised that we should not use rigid free weights. We should be vigilant. We must pay attention to the rate of perceived exertion, the RPE. Always train both sides of the body. We must balance out that training. Ensure that they use any proper technique and don't rush. Gradually increase the exercise using the FIT principle: frequency, intensity, time, and type. Also, with them and with everybody else, we must pay attention to the surface, the footwear that they use, the clothing for comfort, technique that they use, the age of the person, their body weight, and the particular goals that they may have for themselves and that we may have for them. All these things are essential in a therapeutic exercise program. The following is a list of references used in the preparation of this presentation. Bowman 2013, Dixon 2018, Huglum 2016, Kistner et al. 2017, Milner and Keene 2003. Video by pixabay.com, Scara et al. 2017, Therapeutic Exercise Chapter 8, Yoke 2011. This video was made as part fulfillment of a master's degree for the course Exercise Prescription at the University of Trinidad and Tobago in the year 2020. A special thanks goes out to Campus Charles for editing and voice recording. Thanks also goes out to Rakaya Charles for the use of her laptop. Join us next time when we bring to you some other fun information.